Our first presenter is Dr. RAKHI, who is a consultant phacosurgeon at Ahalya Eye Institute, who is an ex-LVPI resident, and she will be appropriate person to guide on how to prepare and plan for exams.
Good morning, everyone. I'm Dr. RAKHI, and I'll be talking on plan, prepare, and conquer your exam preparations. So during the first year, everybody has a lot of dilemmas in their head. Should I get all the books? Should I start reading the reference books too? And should I read every day? Should I start reading the DOS article from now itself? But I would suggest, if you want to know only the main basic symptomatology, standard definitions, and clinical examinations, a Parsons diseases of the eye and the Kansky will be more than enough during your first year. Start early and stay focused. Keep a scheduled time every day. Try to read every day, at least for 30 minutes. And learn from your clinics. Never miss an opportunity to see interesting cases. It's okay if you can't read every day, if you have some commitments with your friends to go out or like that, but try to make it a habit to read every day. Stay focused and stay organized. Start making notes and organize them, read and refer more, and add to the already made notes. So this is a screenshot of the note made by the gold medalist Dr. Harini. She has separate notes for each topic. Like for retina, she has a book, and in the first page she'll write down the contents, and for each cases she will highlight the main important things, and when she reads something from any reference article, she will either add on to it by a sticky note or she will cut and paste the article in itself. Other than Kansky, for some subjects like oculoplasty and for pediatric, you will have to read other reference books. So these are some of the suggestions for the reference books which are required for other topics. Once you become your exam-going PG, it is your time to make a question bank. So try creating a question bank or get it from your seniors and start reading the refraction and the basic sciences. Start preparing for case presentations and start increasing your study hours per day. The most awaited time, the study holidays. This study holidays actually meant for revision only. Try to make a timetable, and you have to keep the volatile topics like the optics and basics towards the end. When you're writing theory papers, try to be crisp and keep a format. For each clinical questions and for investigations, you have to keep a format in itself. For investigations, you have indications, optic, uses, contraindications, and recent advances. Be legible. Have a good handwriting. Even if you don't have a good handwriting, if you leave enough spaces in between, it will become legible and neat. Use a maximum of only 3 colors for highlighting and for underlining the important points. And you can use 1 or 2 flowcharts in your paper. Draw big diagrams and leave space above and below the diagram to make it look neat. And when you're labeling, label only on one side. Once we become the exam-going pages, we already lose the art of writing for continuous 3 years. So you need a mock test, or you can self-test using old question papers, and practice time management while writing. Stick to time. If you're not able to finish one question in time, try to leave spaces for writing extra, even if there is time at the end. If you don't have any theory classes at your institute, don't worry. There are so many online theory classes available. One of this site is from the RP Center AIMS itself. They have even classes on forceps and all the surgical instruments. So these are topics which are not taken at any of the medical colleges or institutes. So they have classes even on the instruments, their designing features, users, and everything. Other than the instrument classes, they have topic-wise classes also arranged, and they usually send it to your mail if you subscribe to their channel. And Shankar Eye Foundation has classes on the most important topic, that is recent advances like glaucoma drainage devices, OCT interpretations, and such things which are not taught in colleges. LVPA also has a set of classes which include best of LVP grand rounds, which is very important for preparing for your practicals. And other than that, this is a problem-based learning, which is one of my favorite, which gives a thorough and in-depth knowledge on each and every topic. Next, you have you and I. This is like a OSCE format where one person will be asking question, the other person will be answering. So this will be very helpful when you start preparing for your practical exams. And if you don't have long hours to watch, like for 1 hour you can't watch, there are such small short videos of 3 minutes which cover each small topics, which will also be very useful for your theory as well as practical exams. So once you start reaching your practical exams, stay calm, composed, and be confident. But mind you, confidence comes only by examining patients, so try to never miss your clinics. You have to study this case performer by heart, and while answering, be audible and to the point. Practice make one perfect. So present cases whenever or wherever it is you are getting a chance. These are some of my suggestions of the books which you have to read for practicals. And while you're preparing for practicals, group study is a must, because in teaching others, we teach ourselves. And ask for help from your examiner, whoever is there during your practical exam time. And for practicals, there is this sessions by iFocus, which mainly focuses on the practical exam point of view. They even have classes on OSCEs, as well as lectures on refraction. This is another group which is called as a Spotify Eye group, in which you can get all the scans, pentacams, all the fields, OCT maculas, and all the recent investigations with the tips to answer the practical exams perfectly. So most of this were taken by from Dr. Pranesh. He is not able to attend this session today. And my sincere thanks to Dr. Krati Gupta and Saurav Deshmukh, also from where I have taken the sources. Thank you.
Thank you, Dr. Rakhi. That was a wonderful presentation. Next.
So I do have one suggestion also. For paper 4, they'll be asking questions on recent advances, and for us they had asked retinal. We wrote during the COVID times, and they had asked questions on retinal surgeries during COVID. So there might be questions regarding, you should be focused on the need of the hour, and there might be questions for DNB.